If you enjoyed podcasts like this, you should check out our other shows on Health Podcast Network. For example, Highway to Health podcast, hosted by Jeremy Quinby, provides guidance, quality resources, and inspiration for anyone seeking wellness in mind, body, and spirit. There's an episode that you should check out called The Value of Our Emotions, where Jeremy helps listeners understand the role emotions serve and what we can learn about our present state by staying attuned to them. Check out Highway to Health podcast on your favorite podcast platform or visit healthpodcastnetwork.com.
Hi, I'm Dr. Raj Sundar, a family physician and a community organizer. You're listening to Healthcare for Humans, the show dedicated to educating you on how to care for culturally diverse communities so you can be a better healer. This is about everything that you wish you knew to really care for the person in front of you, not just a body system. Let's learn together. Welcome back to our reflection series on latent TB care, featuring many community voices. In this episode, Duncan, Frankie, and I continue our discussion featuring many communities again. You'll hear more from our Marshallese guests, Disney and Jasmine, and from the Afghan community with Brishna and Wahida. We'll also be joined by Jean-Jacques, who was in episode 43, who you might remember, talking about the Congolese community perspective on latent TB, or tuberculosis. One of the reasons I split this into 2 episodes is practical. Balancing the demands of a full-time job with producing quality content means shorter episodes are more manageable. But there's a more important reason why it happened for this series: to highlight the need to understand the history and context of the communities we discuss. In this episode, we're going to hear the real emotional reactions to the events at Bikini Atoll. You heard a little bit about this at the introduction of episode 1, but it's a site that symbolizes the enduring impact of historical events on community health, specifically in the Marshallese community. Here's what happened. Between 1946 and 1958, the United States conducted 67 nuclear tests on Bikini Atoll, a coral reef in the Marshall Islands. The force of these tests was 7,000 times greater than that of the Hiroshima bomb. Imagine that. This history is often overlooked, ignored, dismissed, but it has lasting physical and spiritual effects on the Marshallese community. Disney and Jasmine will share their experiences and the ongoing struggle to deal with the aftermath of these nuclear tests. This is primarily a healthcare podcast, so why am I making a big deal about this? Because it is a big deal, and we should understand and learn it. But as a healthcare professional, learning about a community's history isn't just an academic exercise. It's an essential part of providing effective care. Understanding the context in which people live and how historical events have shaped their experiences help us connect with them on a deeper level. When you know what a community has been through, you can understand their unique health challenges, fears, and needs. In the case of the Marshallese community, knowing about Bikini Atoll tests and their devastating effects gives you insight into the long-term health issues they face, as well as the emotional and spiritual toll it has taken. This awareness allows you to approach healthcare with empathy, building trust with your patients, and making them feel heard. Truly heard. As always, thank you for listening. I encourage you to share your feedback. You can visit healthcareforhumans.org to let me know what you think, what you would like to hear more of, or what could be improved. This podcast is about amplifying community voices to help clinicians and healthcare professionals provide better care. I want to make sure I'm always getting better at meeting that goal. So thanks for your help. Here we go. Here's Duncan, Frankie, and our community guests. Duncan, maybe you will relate in this way that as primary care physicians, when I'm trying to put together all the specialist recommendations and trying to say, how do we put this together for you? I want to bring in one more thread to this, which you had brought up at the introduction for this episode, Duncan, about the testing and how that could potentially link to it. Let's listen to a clip from Jasmine about this.
So I've been reading this book about the Outer Islands, and the Outer Islands have their own history. But how much of this nuclear history of Bikini Atoll, how much does that weigh on people's mind? Is that something that's important for the average Marshallese person? Or is this just some like random story that doesn't pertain to them?
I think for a while, it was hush hush. Of course, it's not like dinner table talk. And a lot of those elders, they are passing away. And I think now that a lot of Marshallese people are living and being born in the US, people are becoming more aware. But a lot of the information was confidential, or no one was allowed to disclose it for a long time. And a lot of this information just came out maybe within the last 10 years or less. And people are finding out like how shady it was, like almost a movie. And I think people are starting to understand like this is what's happened to our grandparents and our great-grandparents. So I think definitely in my generation now, we're more aware.
So with this younger generation, how do you deal with that then?
I think we're starting to, it's really complex because we have a military base still till today on our country. It's hard to critique when we are so attached to it. Till now, it's a lot of dependency on it, not just like the whole country, but even like family by family as well. I feel like sometimes people feel hopeless about it, or what else can we do about it? But I know there's a feeling of we want more, whether that's just even acknowledgement or more people to know about it, or just Americans to know about it since it is their history.
Frankie, what do you think? How does this land for you?
Feel a lot right here, right?
Take your time. I know this will be hard to reflect on. And
At some point when I was still in school back home, I think it was around 6th grade, I had made a trip out here to the U.S. I think it was Arkansas. Met some people that lived here, now Marshallese books, and then shared a little bit about where I'm from. It was surprising to me that a lot of folks didn't know. I think it's a really big thing back home. Growing up, we think that everybody would know about it. At least folks here in the U.S. would know about it, since it's their history as well. So coming here and hearing a lot of, I've never heard of that. I've never heard of this testing before. It was hurtful to hear that a lot of that's not being shared. It's confidential, which I didn't realize until I visited the U.S. Jasmine's comment about dependency, that's another thing. It's so hard to say, leave, or we don't need your help anymore. After all this, after everything has been done, we don't want you anymore. We don't need you. It's hard. We were forced to live this certain lifestyle that we no longer depend on our own resources, no longer know how we normally live. So we were forced to live that lifestyle without being prepared for it. And we still don't know how to live that type of lifestyle. So it's hard to say, like, we're so conflicted to say, we don't need you anymore. We don't want you anymore. Because honestly, we need a lot of help. A lot of it seemed like it was a long time ago, but when you really think about it, it's our grandparents. It's our great-grandparents. It wasn't long ago. I don't know.
Yeah. Take your time, Frankie. With Jasmine's clip and what you're sharing with me is most people aren't even aware of it. And in our current environment, this narrative and this feeling of, if you don't want the United States there, then we can leave. But then this idea of, it's been there so long, there's so much to recreate and rebuild in order to truly be independent. And it's hard to do that quickly or easily without a lot of support. And what does that imagined world look like? I'm just reflecting on everything that you're saying because I feel for you deeply in the community. And I think this is all connected, right? Sometimes I have to say this over and over. Yes, we're talking about latent TB. Yes, we're talking about hepatitis B, but this all matters. Which, Duncan, I think part of why you introduced that story at the beginning was getting people to realize, hey, do you even know the context of what we're doing here and how important it is to understand to get where we need to?
Or even more fundamentally, can you provide adequate medical care for a person from the Marshallese community while being completely ignorant of that history?
Yeah.
I don't pretend to be an expert at all, but I think what Frankie was referring to is this legacy of military activity in the Marshall Islands that has direct impacts on the day-to-day clinical encounters we have with these patients. One might be the distrust, right? They were cut off from medical funding for a very long time. It was only recently reinstated, agreement of aid between the countries. I think you can't overlook the fact that the high rates of obesity, diabetes, and that fundamental change in diet which occurred after the military activity there. And then I think fundamentally is that legacy of potential distrust, right? There were some experiments that were carried out on people who were exposed to radiation. And I think this is just the most vivid example of this. But when you think about every other community of people that you see in clinic, every community has a history that I think is equally as important to their identity and to their medical care as what the Marshallese have. And I think the importance is just uncovering that. And I guess the question for me is, how do I do that in a sensitive way where I don't overstep my bounds, not being from the Marshallese community, not having a perfect grasp of all of that history? How can I do my part to increase that awareness for clinicians and say, you must know these things because they have a direct impact on care? And then also trying to elevate the actual voices of people from the communities. And I think that's why we're trying to get these interviews with people. Frankie, I'm speaking for you a lot. Does that resonate with you? How can I do things better?
I'm agreeing with a lot of what you're saying, Duncan. And I really believe in these TB cultural profiles that we're creating, because an easy answer to do this would be like, have community representatives, work with community representatives, right? But that's not easily accessible for all providers. So I really believe in these cultural profiles. I think it's a good first step in doing this work, involving community, raising those voices, and sharing these different histories, the different traumas different communities have.
Do you feel comfortable with me bringing up this nuclear testing thing again and again with your community, or do you feel like I'm overstepping bounds at times?
I don't think so. I believe, like Jasmine shared, that we're asking for more acknowledgement, more awareness. So I don't think so. I think what you're doing is fine, and it's great, actually.
Thanks, Frankie. Thanks for taking time to reflect on that, both of you. I think it's well worth calling out. And Duncan, I appreciate you asking those questions too, to make sure we're intentional about how we bring up something like this. I want to shift back to our original theme of the stigma. I think right now we were talking about the stigma of the Marshallese communities and the history and how that's all related. I want to note that the stigma is not just a Marshallese community thing too. It's actually prevalent in almost every community that you hear from. Let's hear from Dr. Ijara and Wahida and Brishna from the Afghanese community about what stigma really felt like for them.
I guess this leads into our next question. How do community members react when someone in the community is diagnosed with TB? Is there a stigma or shame associated with this diagnosis?
My name is Brishna Sadiki. I recently came from Afghanistan. It's been almost a year I came to the US. Currently, I work as community health navigator and medical interpreter too. Back in my home country, I gained a degree in medicine. I'm a physician.
Yes.
Of course, absolutely. As I mentioned before, there's shame. There's a shame from some of them. They don't disclose it because they don't want to have the isolation. They don't want to be excluded from the community. Something they feel embarrassed about it. And some of them, they feel embarrassed even if they have gone through the TB in the past. And then they don't disclose it in the future because they think that they may gain it again. Imagine if it's a lady who's having TB or was having it in the past, will not even disclose to the person who is proposing her for marriage. And the reason is why she's not disclosing it because she thinks she will not be accepted by the first person who is proposing her. Pupils' awareness, commitment on this. And I think I see that we are lacking some educational health resources about the TB, especially for the refugees and immigrants' families. It's still, this stigma still remains highly in the community. And we have to address this and raise the community awareness.
My name is Wahida, and currently I'm a community health navigator at Refugee Health Screening Clinic with Public Health. And yes, Afghan. I think in terms of people know somebody had TB, there is how the person who has it handles it and how also their surrounding treats them. I think people are not mean to treat the person bad or think that it's shameful for them, but there's so much fear. They don't want to get like the disease. So even if it's a little bit harsh towards the patient, they might do whatever to try to stay away without trying to hurt. But the first priority is to try to protect themselves. For example, somebody I knew who had TB, latent TB. She got it from her mom when she was a newborn or infant. But when she was in her 18 or 20s, she was saying what hurt her the most is her immediate family members not letting her drink or eat in the same cups that they do, trying to isolate her in a room, giving her a colored cup, or they put nail polish on her cup and nail polish on her. And she was telling me, she was trying to socialize with me and lift the burden up and trying to tell me my parents and everybody thinks that I don't know this, but I noticed the mark and the nail polish underneath my saucer, underneath my cup. I know that they're trying to stay away from me. But she was upset. She was saying, I understand that I don't want to get them sick too, but it's still hard. Leave other community members, but it's my own immediate family. When you become sick, nobody's your friend.
Those clips made me see that the stigma is prevalent in almost every community. And that story about the nail polish, how people are doing their best to protect themselves. And she calls it out, this idea of protecting yourself from getting sick, which is what we tell people with public health, leads to this sense of stigma for the person experiencing it. And the second part about how specific we need to be about education in each community. There's this broad education, but like specific for each community and addressing the points that matter to them. I think with the Afghanese community, might be true in other communities too, that, hey, can you get TB again in the future? And how is this going to affect if you're going to get married and somebody realizes you've had TB before? Does this mean you will get it again? And I think the testing can be confusing about this, right? You test for latent TB was positive. You might always be positive. What does that mean? So it makes sense to me why people are feeling this way. I think at the end of that clip, we noticed a call for action for community awareness about these specific points that people are feeling. We need to first listen and respond in a way that's nuanced and understandable for the community. What do y'all think?
I had a lot of trouble understanding why tuberculosis was so stigmatized. And I think it's because in the US, I think we forgot our history of TB. And all these sanatoriums were closed after the effective drug regimens were introduced. But the reality, and from my readings, is that the societal impact and the patient impact of tuberculosis is very similar to what some of the non-treatable malignancies is. It was essentially a death sentence with no treatment. And because of that, it instilled a fear that seems very similar to what cancer still does today, depending on the type. And I think, for me, understanding it better in that context, realizing that it is a death sentence, or if not, a death sentence is something that will mark you for life and make you undesirable in society, helped me understand the stigma and how prevalent it is, especially in these other communities. I think in the US, we have the liberty of forgetting about it, the same way that we've forgotten about a lot of other infectious diseases.
Anything in your mind, Frankie?
I would just agree with this call to action to raise more awareness, right? And not just talking about general information about TB, but addressing these misconceptions.
I find that so much of public health messaging is broad and vague and things that we think are important, when you heard from these clips of specific worries and concerns people have that our messaging should focus on. Like, going back to the example that I was saying, if I'm always positive, does it mean it's always in my blood? I'm always infectious. I think real questions people have, and may not be the simplest to answer, but we need to make an effort in order to overcome some of this concern about latent TB. Let's hear one more clip from Jean-Jacques from the Congolese community about another facet of stigma and the source of it.
We can talk about how the system is bad for like many Americans here who grow up and live here. They can have access to healthcare. But those immigrants who came from Africa, coming here with zero health services, they are surprised to have full of opportunity of services. And now they become hesitant. Is this really free to help me, or just free because they want to trade me something bad? And this is the discussion in the community. How this is so free? How the vaccine is free available, and they forced me to get this vaccine? What's the reason behind it? There's a public reason, but we need to work with the community to convince those people this is free, it's not going to harm you, it's for your well-being, to protect you and your family. This is where we should focus on getting the information to the community especially those newly established immigrants here, because they didn't know that it's free, it's to help them and also their community. I think one of the problems also because the funding for the TB program back in DRC is through Global Fund. So the clinic receiving funds focus more on HIV and TB, since in DRC, the most recurrent co-infection of HIV is TB and hepatitis B. Most of the clinics are featured to be HIV clinics. So those TB people go to be seen in HIV clinic. This is when the stigma starts. You can go to be seen for a TB concern, but because you go in an HIV clinic, people will target you as having HIV. And also because in DRC, there is the direct observer therapy when the people with TB have to go to the hospital every day to be observed by a nurse and taking the TB medication. Guess what? When they see you coming every day in an HIV clinic, they become suspicious. Why are you going to this clinic? Or get what medicine you're taking every day? They know HIV medication is for life. It's a lifetime medical treatment. And when you go out for a certain amount of time with TB, people become suspicious. And you cannot bring those medication home. They become concerned. So people hide their disease. They don't want to expose themselves because they're ashamed.
It was interesting to see another component of stigma and the cause of it. Jean-Jacques brought up an interesting point about how free healthcare sometimes is suspicious. And this idea, Frankie, you brought this up too, that many people come to America for healthcare because they know they can get a kind of care that they weren't getting. And then this happened in COVID too, where we misunderstand what people want. So when things are free and people are quote unquote forced to get them, it seems, hey, what are you doing to me? I'm not paying for this. Is this really goodwill? This suspicion is real. And I think sometimes warranted because we have done some questionable things in medicine and healthcare. It came in the Ethiopian community episode about how we were having different COVID vaccination events for people who have health insurance, who can go to a primary care and get vaccine. And then we had these mass vaccination events in neighborhoods that were through vans. And people were suspicious of saying, hey, are these different vaccines? Why can't I just get the vaccines in the clinic down the road where my neighbor, who's American, has been here a while, and you're saying, I can't go there. I got to go to this place for vaccines. What's different about these? Again, that suspicion is real because I think, especially in many other countries, the privileged got a completely different treatment from people who are not privileged, often better or more appropriate treatment because of affordability. That was one about this idea of free care. And the second hasn't come in quite yet in the other clips is about how other illnesses contribute to the stigma of TB, like the co-infection with TB and HIV that happens in many other countries. And when you're taking all these pills, people are like, well, do you have TB or HIV? Because HIV is stigmatized too, makes me think. We're addressing stigma of one illness. It's important to actually talk about many illnesses and making sure we're doing a concerted effort to normalize care for them. Thoughts from you all?
I think the fundamental thing that I get from this is that people from different countries, especially recent immigrants, view healthcare and healthcare needs and disease through the lens of what they've experienced back at home. And listening to this, I start realizing how little I know about the healthcare system in these other countries, how it's set up, how it's viewed, and their expectation, I think implicitly, is that the healthcare system back at home is representative of what functions here. And I think implicitly we expect the same, right? That whatever care we're giving here in some way reflects the care that they were given before. So it's like common sense. But then for me now, realizing there's huge rift of what people's own experience with healthcare has been and what we ask of them and how it's actually can be quite different, quite disorienting, I think is really important. So I think a thing we're really trying to highlight in these profiles is to highlight the healthcare system in the home country and understand so that providers can start to anticipate what people are used to in terms of a system and what differences that they need to be acclimated to.
I agree. And just as a quick example, I guess, for us back home, right? Care is all in one place, just at one hospital. There's no going to this other specialty or going to the other location to receive care. We're all in one spot. Coming here, we have that expectation as well, right? We just need to go to one spot to receive everything.
And I think we get used to the system, right? Especially as providers, right? We take this as a given that this system works the way it does. And I think sometimes, at least I lose sight of how arcane it can be and how very convoluted the entire system can be in terms of where you pick up a medication, what is a prior auth required for, what is insurance cover, how often you need to change insurances, whether you're in an in-network provider. All of these things that for us come with the territory since we've been in the system for so long, but seeing it from the outside, you're like, wow, that's a lot to figure out and to try to understand, particularly if you're from a system that operates in a completely different way.
I want to also validate when people are like, this makes no sense. Yes, it makes no sense, right? Or Frankie's explanation of what it feels like at home seems beautiful. You just go to one place and we'll take care of you. This is your healthcare place, right? And the idea that our system doesn't function like that. I'm thinking about how the idea of, if people have heard about the hidden curriculum, when people apply to be in medical school, then go into medical school and start being in healthcare facilities, the hidden curriculum is what's taught that's not in the actual curriculum of how things are supposed to work and how things work that you learn on the job. And it takes a while to learn for all of us healthcare professionals, and then we became used to it. And then it falls on us when people are coming to see us to explain it, and we're doing a bad job about it. When I think there could be so much more work upstream when people are coming here from other countries to talk about how U.S. healthcare and everything works, which there's definitely not enough education around, in that people get brief education on certain things and then it's like, good luck in America. And then you try to piece it together with community voices, some education. But I think this would be so meaningful if there was a better quote unquote curriculum for immigrants and refugees on how things are going to work, and almost a guide for their healthcare journey.
It sounds like you're setting a stage for some maybe healthcare orientation profiles that are specific for where country people are coming from, that can anticipate the differences that are seen. I think that's a great idea. And I think, like you said, we got exposed to this hidden curriculum. We've internalized a lot of these very idiosyncratic facets of our medical system.
This has been so meaningful for me, actually quite powerful. It makes me think of, man, I should do a lot more episodes this way, because I'm hearing directly from community in nuanced and specific ways, and not in my studio here or in an office meeting pontificating of what the community needs or things. And this is such a more powerful way, and hoping other people listen to this too. I like to end an episode a few different ways. Today, I want to talk about what is one thing you've taken away from this conversation that will affect you going forward.
From my point of view, I think the biggest thing is how much I have to learn about these communities. I thought I was pretty well versed. I'm curious enough, but I was just shocked at how ignorant I was about, I think, very pertinent histories of a lot of the communities, and how a knowledge of just a little bit of those stories and that history can be very helpful in not only establishing connections with patients, but also understanding where they're coming from. So for me, it's been really a call to grow, to read a lot more, and to become more aware. I think of just an incredible opportunity. And I think the more that I can do to learn about these cultures and their history would be really helpful. And then I'm also very grateful for the incredible access, the time that Frankie has given, and his community mediators, and just the community members, and just how vulnerable they've made themselves, how honest they've been about their frustrations with the system, about what they appreciate, and I think just a very complex view of what they have, of their experience in America.
Agreed. Frankie?
I think it's pretty much along the same lines as Duncan. Come to realize cultural literacy, how necessary it is to healthcare, especially if we're working with communities that are not from the U.S. And everybody has their own stories. It's something that I've learned that it's just necessary to be a part of this.
Thank you, Frankie. Thank you, Duncan and Frankie. I learned so much. I appreciated this so much. And maybe we'll have to do this again, because I found this quite meaningful. And thank you again for coming on, and for the sponsorship by King County Public Health. TB Clinic for making this possible.
Yeah, thank you.
Thanks again, everyone, for joining me on another episode of Healthcare for Humans. If you liked this episode, as always, my ask to you is please share it with one other person and go to healthcareforhumans.org to sign up to be part of the community. I'll see you next time.
If you enjoyed podcasts like this, you should check out our other shows on Health Podcast Network. For example, Highway to Health podcast, hosted by Jeremy Quinby, provides guidance, quality resources, and inspiration for anyone seeking wellness in mind, body, and spirit. There's an episode that you should check out called The Value of Our Emotions, where Jeremy helps listeners understand the role emotions serve and what we can learn about our present state by staying attuned to them. Check out Highway to Health podcast on your favorite podcast platform or visit healthpodcastnetwork.com.